Okay. Awesome. Oh, that was left over from class. Right. Okay, all right, you guys. This is our official welcome online, and here we're really glad to have you guys here. This is our pregnancy, birth, and babies class. Are we going live? Live. Oh, okay. We're double live. Oh my goodness. No pressure. So for those of you who haven't met Heidi, I have to do a big intro on this gal. She's really amazing. This is Heidi Rousseau, and she is a mom of 4, and she's a very successful businesswoman. I mean, she has a dōTERRA team, but she also runs a hair studio out of her house and does amazing things with, you're involved in all kinds of things with your church and community, and she's an amazing mama, and she has a story to tell, and we'll let her tell it because it's really amazing. But she is also a doula, and she was my doula for the birth of I call him my baby, but he's 2.5. I guess he's not really a baby anymore. He'll always be a baby. I know, it's true. The last one. And I was really glad that Heidi was there because my husband was actually singing in an opera on stage while I delivered here in the hallway at the Foothills, my first Canadian baby. So I was really glad that Heidi was there, and it was really good. She kept me calm and really helped me through the whole thing. It was really awesome. Really good energy. Yeah. So anyway, Heidi is gonna teach the majority of this class. I might hop in a little bit, but we are gonna talk about pregnancy and just kind of some of the best tips for that, and then the birthing experience, and then a little bit about babies too. See how far we get with time and everything, and then. This is interactive, so if you guys have specific questions, just jump on in. And online too, you guys. Just type them in the chat box, and we'll see if we can get to them at the end. But do you want to share the story with them? Yeah. Okay, because it's such a wonderful story. I think that these guys need to hear. So, fantastic.
Well, like Amy said, I'm a mom of 4 and a doula. I'd never had the opportunity to use oils when I had my babes because they're 8 and older. But in being a doula, I've had lots of now opportunities and experience using oils with some of my clients, and it's been an amazing experience, but nothing that I had actually a personal experience with. So I kind of couldn't attest to that personally, but now I can because I'm actually 15 weeks pregnant and I'm a surrogate. Yay! So the baby that I'm carrying is not mine genetic material, but it's for a good family friends who do not have the ability to carry their last baby. So now I get to sort of incorporate all of my, I guess, info from just my experience as a mom, and then as a doula, and now in this pregnancy. So it's been really great to have oils to go to because I didn't have the, I mean, I'm sure they existed 8, 10, 12, and 14 years ago, but I didn't have them to go to. So now incorporating it, I have some personal experience. So now I can actually talk from saying, I used this and it helped, or I have something to go to and share in that way. So yeah, I kind of get to touch all the spectrums of as a job, but then now personally and in this pregnancy as well. So, and yeah, like Amy said, please just ask questions and interrupt. And if you have questions about anything, it doesn't have to just be oil if you have a surrogacy question, because a lot of people are like, I've never met a real life surrogate. So it's kind of a crazy thing to be a part of, but it's really cool and really sort of affected my life and my family, and something that I had the opportunity to do. I guess my uterus was just going to waste. So that's what I was told by the fertility doctors. So they were like, you should use this. And I was like, okay. Yes, now it's being put to good use. So a third of the way through, and now I actually have some real life experience of like morning sickness and stuff. So I'll probably get into that, I guess, first, like early pregnancy, just because I think that's the first sort of, I hear the most from my clients and from people that are often looking into using essential oils. Is it safe? And just like it would be, is it safe for children? Is it safe for people with sensitivities? Is it safe for all of us? My answer would still be yes, absolutely 100%. And the real critical part, I would say, especially in pregnancy and pregnancy-related issues, is that education is key, and really being in tune with your own body. And I think that's important for health in general, to really know what you're experiencing. So I would say for me now, in taking it into my own pregnancy, there was a lot of stuff that I would recommend for people that I couldn't personally stomach just because I had severe morning sickness with this pregnancy. So there were a couple things that totally worked that I felt really, really safe with. And because my body was giving me the go-ahead, when you're aware of that and in tune with that, then you can sort of move forward with that. So using oils like ginger or lemon or peppermint, even just to smell it, would sort of launch me into being like, okay, I can take a second. And if I did actually then get sick, I had something to go to after, sort of to reestablish that sort of baseline, I guess, so I could then eat some food or sort of feel a little bit more normal after that. So yeah, I would say my go-tos for that, and that I recommend to people, even just to smell, if it's something, because it kind of jogs you out of that like overwhelming sensation. Scent, obviously we all know that that's a really, really powerful thing. So it sometimes could just veer you off that track really, really quickly. And actually Amy made a great suggestion to me that I hadn't tried until we talked, and that was cardamom. So that one, I started to use that just recently, and that one really, really kind of, it's not like ginger or lemon or peppermint. It's sort of like this interesting spicy combo, but it would, again, sort of veer you off of that, like if you're driving, sometimes you can't help it, you just go for it. But yeah, if there wasn't an opportunity where I could actually sort of stop and I couldn't reset my system that way, just smelling an oil would really, really help me in those early days.
For me, for whatever reason, if I put cardamom behind my ears and on my wrists, that seemed to help a little bit.
Give you enough.
Yeah. Mm-hmm. Or a break for just a minute before it worked.
It kind of stabilized you.
It usually did.
It's gonna be okay.
Yeah. That one did it for me.
So because that's one of the biggest early pregnancy symptoms, I would sort of cover that one. Another one is being deficient in certain things. For me, I have some like low iron anyways, but staying on Lifelong Vitality has helped my iron to sort of regulate. And when I do dip down and have sort of a little bit of anemia, or like my system's kind of out of whack, I could just increase a little bit of the one that has iron in it. I didn't really know. Yeah. So that would help stabilize it. So that was really, really huge too. And again, super well absorbing. So if anyone has been anemic or had to take iron, especially in pregnancy, because another complication that nobody really wants to talk about in pregnancy is like being really, really constipated. So when you have really low iron and you're having to take iron supplements that are not natural and not absorbable, like the Lifelong Vitality, you then sort of are compounding that problem. Which it's awesome to have oils to go to now, because then you're sort of in a cycle of having to try to reset your system so that you're not having those like backed up problems, but also stabilizing your iron. So you're just in this really, really awful cycle. So again, then having DigestZen to go to reestablish and support that stomach system, that digestive system. And then as well, the Terrazyme. That was the only one that I didn't grab, but taking that with every meal has sort of, again, stabilized when I did have to sort of increase the iron or iron-rich foods, then I wouldn't have that compounding problem. So that was really, really helpful. And I think that's a postpartum problem too, especially if you've had a C-section or any sort of like lower abdominal upset, like severe tearing, or I don't know if you share your story much, but there was lots of uterine and upset. So like that can affect your whole system, like not just like urinary, but also your bowels. So focusing on really keeping those things stable and having something natural to go to was really, really like great to recommend. And now it's actually helping. So that's been huge. You passed it. Okay, that's what I was going to talk about next. Another really heavy early symptom for many women is really bad heartburn. And something they don't explain to you is that heartburn is actually low-grade nausea. So when you experience heartburn, you're actually experiencing the same symptoms as someone that is extremely nauseous, but that's sort of the way it's kind of presenting itself. It's a lot easier to deal with when you use the digest tabs. And if you're not nauseated, then the digest tabs don't make you feel ill. For me, my biggest thing that I need to avoid in pregnancy is anything sweet. And the digest tabs taste like DigestZen, but they're super sweet. So I would just like really, really quickly eat it, drink of water, but it would totally soothe the heartburn that I was having, and also then sort of to diminish that low grade nausea. So those are sort of the main, I would say, early pregnancy symptoms that I have experienced. Does anybody sort of have anything else that they're like, this is something that like kind of plagued me or got to me or took me down? Any like questions or anything about that?
Maybe tiredness, just being really tired and fatigued.
Okay, that is why I grabbed the Serenity soft gels. So all of my other pregnancies were in my 20s. So literally I would just be running with toddlers, my head would hit the pillow, and I would sleep the whole night. Even if I had to get up to go to the washroom, I would come back and like out. So I never worried about lack of sleep. Totally different story this time. I'm 38, I have total insomnia. So I will be up like from 3 to 5, like totally exhausted, but laying there like eyes wide open. I'm like, what's the deal? So I started with the Serenity soft gels just almost experimentally because I had used them before when I've had, you know, some restless nights and felt like, okay, yeah, this is good support. But starting to take them consistently for about the last 3 weeks, I have had really, really good consistent sleeps. And that first probably 10 weeks was just like all over the map. So remembering to do this about half an hour before I was actually going to turn on the light every single night and kind of incorporate that with my evening routine of shutting everything down. I think it's probably ambitious to say I could just pop them in after, you know, watching a movie and my brain would shut off, but it was more that incorporating them into a little bit of like a winding down scenario, which again, to remind people that oils aren't some like magic trick, but to incorporate them in your life in a way that supports healthy choices. And that included sleep. I mean, the insomnia was totally pregnancy related, that I was like, I'm tired, why am I not asleep? But I read the older you are, the more your hormones affect you. And so being aware of that now, we're like, okay, incorporating this. And now for the last 3 weeks, I've really only just gotten up to go to the washroom, which cannot be avoided when you're pregnant. And then I would fall right back to sleep. So that was a huge, huge change for me and something that I didn't get to experience before. So super glad that I have this now to go to, because I don't want to take something that is synthetic or that's going to cause dependency. So yeah, that's been super, super helpful. I also, just to stay healthy, the reason, and I talked about this with the mom and she knows that I'm sharing it, the reason why my friend Chantel needed a surrogate was because she got strep in her uterus right after she delivered. And the infection was so rampant, her uterus actually sort of shredded and disintegrated, so they had to remove it. But one of the things that I talked about with the midwife that we're using now, she said to keep your immune system like in peak working order. She's like, you know, it's important for everybody, but when you're pregnant, you have such an increased blood volume. You're already susceptible because, especially during that process of delivery, there's a lot of upset. Again, like there's infection and sometimes tearing and stitches and, you know, sterile instruments if you're not at home, and just like other things that are affecting your system. And they said, you know, we would just recommend for women, because there have been more cases of strep specifically in women that have just delivered. And in my friend Chantel's case, she's 100% healthy, just with no uterus. But in a lot of other women's cases that get this, like the situation is a lot more dire, and like loss of limbs and death. Like, so it's one of those things. I mean, it doesn't cause me to feel afraid, but I do. Then that's okay. I love background music. Well, I'm talking about death and loss of limbs. This is perfect. To really incorporate, again, knowing where my body's at and my system, and keeping it in like prime working order. So I have not once stopped taking my On Guard soft gels. That's like a morning and night ritual for me, and I'm going to do that right up until, and probably double up my dose at the very end, because there's infection that comes, and so I would rather my body be really, really ready to fight that off and stay in like prime working condition than be in that kind of sketchy zone. So yeah, that's some of that. What else do I want to go to? Does anybody have any questions so far? Or we're sort of past early pregnancy.
Are there any oils you should avoid?
in early pregnancy?
Again, I would really trust your body. Like, I don't do any sort of floral because that immediately triggers my sort of pearl sensation.
That triggers mine now, and I'm not.
Okay, totally. And so that's just an increase. I do recommend for my clients to stay away from clary sage and clary calm in early pregnancy, just because those are known to increase the intensity of your hormones. Now, someone that maybe was feeling like they didn't have enough, like women that are like prone to miscarriage, you could actually use clary sage to encourage, like when women have like chronic miscarriage and they have it tested, sometimes it's because their body's progesterone or their body's estrogen doesn't kick in. So to use that, while you're trying in a consistent way up until you have like a positive, 8 to 10 week positive.
So would that also help with like IVF treatments?
Totally.
Interesting.
The mom of the baby in our very first round, she had like way too much estrogen to the point where you can have like an overproduction of estrogen that can cause you to be incredibly sick. And I just gave her some clary sage to help stabilize her. And we did have to stop the round that we did, but it came down like almost immediately. So yeah, it was, that's what I used on Amy. And,
to get the
in delivery.
labor going.
So it does both. So that's why I would say in early pregnancy that I would stay away from clary sage and clary calm. If everything is going well, that you wait until you don't. It's not one that I would say that you would totally even need until you're ready. When you're ready to go. Yeah.
When I was past 39 weeks, I put clary sage on my ankles, and a half hour later, my water broke.
So you're good. I've been like 36.
I know, 30. Why'd you make 35?
I know.
I know. Yeah. 37 on the dot. Yeah, I should. Yeah, and then I did give her like pressure point and foot treatments with clary sage, and
that definitely made my contractions super effective. Heidi.
The story with Amy was funny because they were like, "We don't think you're in labor," because she was like super in the zone and like kind of hypnobirthing. She's like with the ball, and just like super chill. And I was like, "She's in labor," and they're like, "Yeah, we're not really sure." And I was like, "She's in labor." And finally, I was like, "Let's get this going, Amy, because they're not going to believe you until they start to see some like physical signs." And then I think I was like, "Let's get up. Like, you need to move positions. We're gonna like get this going." And then I think it was within half an hour. They were like, "Oh, you are in labor."
So annoying. Yeah. I mean, it was good. That's what we wanted.
You can't deliver in the hallway, so let's put you in this closet. That was literally this. No joke.
Yeah. That was my experience for Canadian hospital. It's like,
but hey, it happened fast.
It did,
right? So like, you can do anything for a short period of time.
You can do anything for sure.
And she did. Very, very well. But I will attest a lot of that to clary sage, then kind of getting from water break to like end, and it definitely intensified. So that's one to answer your question with a long, fun story. I would avoid that in early pregnancy. The only other one that I recommend people to avoid, and not altogether, but just minimally, is peppermint, but at the end.
Because of the milk production?
Because of milk flow. Yeah. And I don't think that you have really a reason to rub peppermint around your breasts, but if you really felt like you needed to, you could. But I still use like Breathe right now. I use Deep Blue quite a bit for any sort of strain, or like I'm early on, so I'm not really feeling a lot of the physical symptoms yet of pregnancy. My boobs have totally doubled in size, so that's lovely. But I'm not rubbing peppermint or Deep Blue on those. But I do use Deep Blue, and it has peppermint in it, so it's not something that I'm afraid of. No. If you did feel like your milk flow was decreasing, the beauty of oils is that there's a oil that will increase milk flow. I got it over to that's fennel. So yeah, and fennel smells lovely and it tastes good. You can drop it in some tea or take a couple drops in a capsule.
And as far as peppermint decreasing, that is actually more of a myth than based on experience.
Okay.
Yeah, you can read some articles online about it. But yeah, it's rare. But if somebody did experience that, then absolutely.
Yeah. And again,
it increases or decreases?
It can decrease milk flow, but it's very rare that it does. So it's more of a myth. It's actually less common.
And no one, like I said, you're not,
or
and using it for like a headache or like using it with deep blue.
Yeah, because I have that, and I was worried about if I should use that or not.
I never stopped using any blends that had peppermint, or even just using peppermint on its own when I nursed for 18 months. Yeah, it never affected my milk flow. No.
Okay. So I mention it because that's the only thing that's ever been kind of mentioned.
Reported ever. Yeah, and it's rare. It's rare.
To it.
Yeah.
Question? Yeah, so I'll pass around the clary sage because I think it's a stronger sort of earthy, grassy smell, but it actually is really lovely. So to use it at the end is nice. Yeah. So this is kind of a new one for me, but in doing some research and watching Dr. Hill's presentation on copaiba, I'll let you all into a little secret of mine, and that is that I do use CBD oil, which is a derivative from cannabis, but obviously not in pregnancy. But CBD has a very similar chemical constituents to copaiba, and it's one that I was using for relaxation and sleep and sort of some higher emotional trauma stress prior to pregnancy. And I find that copaiba is like offering a very similar effect when I take it in a capsule, like at similar times, like evening. So I really it's kind of neat that doTERRA now has copaiba that has a similar chemical constituent to CBD. So it doesn't have an overly strong smell or flavor. So you could just put a couple drops under your tongue or put it in a capsule. But it also sort of in conjunction with the Serenity soft gels, like in the evening, if you're feeling if you're prone to anxiety or higher stress about pregnancy or babe, that's again a safe one to take. There's controversy about actually taking CBD in pregnancy, but it's one that I wouldn't mess around with because
Dr. Hill said too that when they tested a lot of the CBD oils across the board that are made out there, there was only like 2% CBD oil in those oils anyway. Right. So it's not like it was a strong, sustainable source of CBD oil. Lots of fillers.
So another cool one to mention, and one that I haven't had previous access to other than after it was released. So
great for some discomfort and teething babies. A lot of mommies that use the copaiba on gums or on the jaw.
It's a lot less intense than clove.
That's what I was just going to say. It's less intense.
Yeah, a lot less intense than clove.
Yeah, so it's nice.
For other pain and like discomfort in pregnancy, specifically just physical like body pain, going to something like Deep Blue, peppermint, or Aroma Touch. I really like Aroma Touch for it because the scent is a little bit different, and for me, I have a wintergreen aversion. So as much as I love the Deep Blue and how well it works, sometimes I've had enough of wintergreen, but Aroma Touch has a little bit more of like a peppery scent, but it does that similar thing for the body. It does bring some like pain relief in the muscles and the joints. So that's a nice one to go to if you do have aversions to certain smells. So it's kind of an alternative to Deep Blue that you could use.
I like to alternate it just to alternate it. Yeah, because I had leg cramps. I really experienced leg cramps during pregnancy. And Deep Blue was great for other aches. But for the leg cramps specifically, there's something about cypress. I really love cypress. And balance is a good one too, but Aroma Touch really just took the edge off of the leg cramps specifically, the pregnancy leg cramps.
Yeah.
So
did you use it for restless leg syndrome, or did you have restless leg?
In pregnancy, yeah. We're calling it temporary restless leg due to pregnancy.
Anything due to pregnancy, it could just blame it on that.
Yeah,
it's temporary.
Well, I never had it when I wasn't pregnant, so
there you go. It was your pregnancy related.
I just did not have Aroma Touch.
No, right? No, now it's beautiful.
Oh, yeah, it's a beautiful option.
And just to touch on that, the dōTERRA Touch is really, really nice to have as a go-to, because a lot of the oils that I'm talking about in the Touch kit, they're already diluted. So using them throughout pregnancy, if you do develop sensitivities, just skin or scent, they're a little bit more toned down because they are with the coconut oil. And you can sort of merge them right into baby because they are for the more sensitive skin. So
can I add another thing about Aroma Touch that I think is, it just kind of hits a few different things at once besides the leg cramping?
Varicose veins.
Yeah, varicose veins, yeah. And then the other thing was retention, water retention. So I got super puffy towards the end, and drinking lemon in my water, of course, really helped minimize that, but also the Aroma Touch topically.
Grapefruit is also really good for that. So
Yeah.
I don't know if grapefruit oil works the same, but eating a grapefruit, it flushes your system.
Grapefruit oil does work very similarly. Yeah, different chemical makeup, but very similar in what it does. Yeah.
that's awesome. That's not going to happen to me at all.
No way.
It's going to be winter, right? That only happens in summer. That's December 6th.
Right, you're not gonna be crazy in December.
I'm going to be jogging still.
You're skiing. What are you talking about? Her dad is an Olympic athlete, right?
Yeah.
Yeah.
Won a bronze medal.
Yeah.
Yeah. No, it's my time to fame. It's not any things I've done. It's my dad. It's how amazing my dad is. Amazing. Yeah. I do also want to touch a little bit on Immortelle and frankincense for pain as well. I think it's one of the ones that we sort of sometimes forget about or miss in pregnancy, but it really, really helps. Specifically if you have like a smaller joint issue, but that affects your whole body. Like if you had SI. Did you?
Yeah.
So only in my last pregnancy did I have like SI joint things where it would come out. But now when I have any sort of like pull or some sort of joint or muscle, like where a chiropractor is needed, or you're like, I need extensive massage or physio, to use Immortelle on the pain points, I find super, super relieving. It does have some of those like blood-brain oils in them, so they are penetrating a little bit deeper. And I kind of just love that it's another, not only does the Deep Blue and the Aroma Touch, it actually takes the pain away, but this kind of deals with it on a deeper level. There's frankincense in there too. So that's awesome.
What's SI?
Oh, your
Sacroiliac
sacroiliac joint. Yeah. Sorry. I didn't know either. I was like, it's your SI. What does that mean? It's your SI. Yeah, it's like it's like where your hips almost connect up to your back.
Okay.
Yeah, but it's kind of one of those weird, because you have so much relaxin in your body when you're pregnant, you could be walking and be like just fine, and all of a sudden you're like, oh, and you like totally loose, and your leg goes out, and you're like, what happened?
Well, I know a woman that actually had to use crutches because she would get too much loosening, and she had to be in a wheelchair with one of hers because she couldn't walk because she got way too much of the relaxing hormone.
It's very
and her
easy.
hips would
Like go out.
and
Yeah.
it was really actually very, very bad.
Yeah.
So when she was lucky, she only had to do the arm brace crutches to walk, but
That also is not going to happen to me at all.
yeah.
But yeah, it's really, really very common. So to support your system like that is fantastic.
You said Immortelle and
Frankincense. Yeah. And I mean, it's in there, but I just kind of double up.
Just some extra.
Yeah, I
Extra
always double
frank.
up. So then I kind of moved, we kind of talked a little bit about labor, and that clary sage really helps with that. Using Deep Blue in labor, peppermint in labor, and Aroma Touch in labor are great sort of medium sort of pain relief, and great for certain pressure points, specifically if you have like some back labor, to use like just some more techniques, but using oil. Black pepper is a great reliever of pain. And kind of incorporating those all together. I actually like when you mix black pepper and Aroma Touch together, because Aroma Touch I already feel has like a peppery sort of scent to it. So mixing those together, they don't cause too much of a scent thing where you're like, oh, that smells awful, because you are very sensitive in labor too. it's kind of a time where you're like, get away from me, I can smell your breath, and like you have a rag face. So you might be sensitive, more sensitive to oils, but I found that black pepper and the aroma touch, actually, do you still have that? If you want to smell them together. I just kind of find like it's a good combo kind of together.
Oh yeah. Oh.
And yeah, I mean, labor is what labor is, and it does what it does, and we'll take the time that it takes. So,
Oh,
that's right. That's what I said. Just for your own kind of awareness, like, oh, those two go together.
I was gonna say that emotional oils too can be a really huge catalyst as you're kind of going through stuff. Sometimes when you're in labor, like you meet your husband, you know, like totally.
Because hormones and emotions run high. It's true. It's very true.
Even all the way through pregnancy, not just delivery. But you're like, there's some days I'm like, I hate my husband.
Not just during delivery.
Yeah. Forgive, console, or whatever. You know, like all of the emotional oils, like whatever speaks to you. I think to use those, like how they can really help shift things, so that you can just work through those emotions, just recognize them for what they are, that they're gonna pass.
Well, and again, to really listen to your body. Like if you find that something always calms you down, like take 5 minutes, you know, even daily, and just do like a meditative practice. For me, it's peace. It's always been peace. I loved dōTERRA before they even came out with peace, and was like making my own kind of peaceful child blend from that recipe online. And then dōTERRA came out with peace, and that for me is like that keeps me stable. dōTERRA is like it's my spirit oil. So yeah, something like that is really, really beneficial too. And again, listen to your body. When your system is saying like, nope, that's not for me, move along to something else. And sort of, I think the number of oils is so vast. If one doesn't work, there is one that will. Even something like if you can't handle peppermint and you can't handle the deep blue or the aroma touch, like using melaleuca, because it also brings a tingle and maybe it just smells a little bit more clean to you. That's another great one to use. So I think just keep on sort of trying and having an open mind to whatever it is that your system is kind of longing for, and just being in touch with it on that level.
One little thing, this could be before, during, or after hemorrhoids. Hemorrhoids can be an issue.
Right.
Lots of really great recipes, but one in particular, cypress, helichrysum, and peppermint, of course, diluted. That can really bring a lot of relief. So yeah. And then there are a few versions actually that you can do. You can actually you can create your own kind of like tucks. Like, you know, tux pads, like you can use those little makeup cotton pads, and you can spray it down and then put them in the freezer and then use those if, you know, if you ever need a little bit of help with that.
What did you say, helichrysum?
Helichrysum is cypress and peppermint. I mean, there are a lot of different recipes, but that one's a really popular one. And it works really great.
I was just going to say, to make a vaginal spray for yourself, like pre and postpartum, because you will start to experience that like low pressure, whether it's hemorrhoids or vaginal. I think the same spray can work for everything, and then just to have it there beside your toilet, and every time you clean, you just spray the whole area. And to that, I would probably add like lavender and frankincense if I was going to do the whole area, because it's going to be relieving for the hemorrhoids, but also for the
Yeah, I actually did the for the badge.
Yeah. That's what I call it. What it is.
I did pads, and I literally, they're probably the most expensive pads on the universe.
Right, because they got frankincense on.
Totally, it was frankincense and helichrysum and lavender,
probably some geranium.
And geranium, yeah. And I sprayed down my pads and then put them in the freezer ahead of time.
Yeah.
Oh, it's my best. Smells glorious.
Yeah, it is. And like that first week, and with my pre-oil babes, I just had padsicles and thought that was great to actually add the oils that are going to help soothe the area, decrease swelling, bring about a little bit of numbness. When you add like the peppermint to it or the melaleuca to it, you're bringing a little bit of numbness. Then you're also kind of taking that burn away, and it's increasing your healing. So why not? buy those expensive pads.
It was so worth it.
Yeah.
They were expensive when I looked at all the bottles that I used, but it was so worth it. And I actually have different experiences to compare to, because my first delivery was twins, and it was cesarean, and it was an epidural. But then my second was a VBAC and an epidural, and then my third was natural and oils. Like, and it wasn't my choice. I actually was begging for an epidural, but they're like, sorry, it's too late.
You're in the hallway.
I hate you. Yeah. But the irony is even though he was my biggest baby and he tore me apart, I actually healed faster. It was half the time healing this last time, and I'm in my 40s. Like I had babies in my 20s, 30s, and 40s. So to experience that in my 40s and realize that I actually healed in half the amount of time was crazy to me. So it was really interesting. Like using oils
And
versus
only oils for this last one.
Yeah, only oils. Yeah, that was it. Yeah. So those pads, man, totally worth
Make
it.
those expensive pads. Heal up that batch. Another thing, if you experience C-section or any sort of like surgery, to incorporate healing that area faster using frankincense, diluted with coconut oil and or the immortelle. Both are going to increase healing time and help with scarring and just like minimize that.
And they would help guard against infection too, wouldn't they?
Totally. Correct X is another one that's really great.
I did grab it. It's over there.
Oh, okay.
Yeah.
Here.
Oh, sorry. I didn't look.
Oh, right
You
here.
do have it.
Yeah.
Nice.
Here's Correct X.
You do have it.
So it's kind of, have you guys seen this? It's so awesome. It's kind of like
dōTERRA's really awesome polysporin.
Yeah.
Yeah.
It smells
And
good.
if you are quite
It's a really
sensitive
good
in that
eye
area,
cream too, if you're just saying.
we're all women. Aren't we the ones that are most like targeted for skin
And it's like
products?
super cheap for an eye cream, but it's a really good eye cream.
That's funny. That was fun.
It doesn't
yeah.
sting on the kids either.
Right. It's not like spraying those antiseptic sprays that make it go down. And then also to use Clary Calm after to help bring down your uterus. Like, I don't know if anyone's experienced this, where they like come and they like push on your uterus to be like, is it shrinking? Right. You probably have that the most fresh in your mind. You're like, I just peed my pants.
This is the worst thing you're ever
Right. So continuing to use Clary Calm for your 6 weeks postpartum bleed and healing is also going to help your body to get that uterus back down to size.
Help it contract down.
Totally. Absolutely.
Does it help with the pain?
Okay, this is my next thing.
Because that fourth kid, man,
I
that fourth
know.
kid hurt.
I know, because the afterbirth, right?
Yes.
Okay, then
You
this
gotta
is-
latch them and you're like, oh, it's gonna hurt so bad, it's gonna hurt so bad. You
I
gotta do
know,
it.
and
You
you're
gotta
like-
feed them.
you're like
it's really
you're
gonna
like-
hurt.
Yeah. So
And it did.
So it's I'll tell you this. It will intensify that pain, but it will be over faster.
It's more effective. That's how I felt about
It's
the labor.
more effective.
It was
so your labor intensifies, increases, but it's over faster. Same with your afterbirth pains. It's going to be bad, but it's going to be bad anyway.
Yeah. Fourth kid, man.
So would you rather have it for the whole 6 weeks, or would you rather have it for 2.5?
Oh yeah. No,
So-
it was a good month with my last.
Yeah.
And it was not pleasant.
That's the trade-off. That you're actually increasing your body's natural speed of getting it, because that's why it doesn't hurt the first time. It's only been stretched out that one time, so it goes right back down to
It
size.
doesn't hurt at all
in
the
a
first
week.
time.
So Heidi, you were saying use what for that?
Clary
Sage.
Oh,
or Clary Calm or Clary Sage.
Oh, Clary.
And do you rub it on the abdomen? Or?
I would do abdomen and probably like temples, like a lot of places.
I just did it whenever I nursed. Then that was like, okay,
Yeah.
I'm nursing. There it is. I did that. I had my little routine, my little setup.
I used Clary Sage in early labor as well as after my water broke.
Okay.
But arnica
Mm-hmm.
is amazing
For the
the
afterbirth?
afterbirth and the
To
bleeding.
take orally or to put vaginally?
We're going to take orally.
Okay.
So I didn't know to use the Clary Sage afterwards, but I could still start incorporating that because he's only he's a month old today.
Totally.
But the arnica is like wonder.
Mm.
It's like a week and a half to 2 weeks and you're done.
That's awesome.
Yeah,
Good
it's
to know.
awesome.
Yeah. To incorporate it all together.
Thank you for the 10.
Can you explain a little bit more what you're talking about? Because I don't know.
After pains.
This is my first pregnancy, so I haven't experienced
Okay.
that.
No,
it's not.
Honestly, it's so weird because actually
It's kind of like a very mild cramp with your
nobody tells you about it. Yeah. And then you're like, what is going on? Something's wrong. My appendix just ruptured.
Yeah.
Like that's how bad it is. So, but with your first baby, you don't experience it.
Yeah, it's like
So
mild cramp.
basically, it's your body's way of trying to help your uterus shrink back to size.
Okay.
And you want it to happen really rapidly because you don't want a full uterus when there's nothing in it. So when you have your first baby, it usually like, so what they will do immediately after you deliver is a nurse will come along and like put her whole entire weight on your body and just like push down. And like blood clots and like stuff will come out.
Yeah.
You'll probably pee, so that's totally okay. But you'll feel like a solid, like you'll feel like a solid ball.
Yeah.
Your uterus is like a solid ball of
Okay.
kind of like tissue, almost like you have like a softball inside your body.
Okay.
But then when it's your first baby, within 3-4 days, that's pretty much gone. Like you might push down and be like, oh, I don't really feel anything. Whereas each consecutive baby that you have, it takes that much longer for your body to try and shrink your uterus.
Okay.
So every time you nurse, you're sending those same hormonal signals like you had in labor. So it actually feels like labor all over again.
Okay.
It's cramping.
If it
Okay.
makes you feel any better, I have 4 babies. The last were a set of twins, and I never had any pain.
So no one wants to talk to Michelle.
It depends.
Yeah.
I had other things.
So if I have pain, I'm gonna.
I'm just saying it doesn't.
Yeah.
Yeah.
And you know what? Everybody's different. Like maybe Michelle's body is super efficient to shrink her uterus back to size within that first week. And so usually you are on a lot of Tylenol and Advil for other, like, you know, swelling and vaginal tearing or like whatever it is that you've experienced. So you might not feel it anyways, but each consecutive pregnancy usually lasts longer.
Okay.
So, but I've never used oils for a pregnancy. So, and this is my 5th pregnancy. So I'm hoping that will not be like a 6-week ordeal, but it will just be a 2-week and I won't even notice.
Okay.
So
Good to know. Thank you.
how pregnant are you?
I'm only 9 weeks.
Okay.
I shouldn't
Yeah.
really be telling anyone.
We told everyone online, but they so they have no idea who you are. What's your name? Go to her Facebook page. But do you have any other questions? Because it's kind of all, I guess, for you. Does anybody else?
You
have
had
your
the
hand?
hardest thing about pregnancy is that you read the books and they say, okay, so here's what's going to happen. And they'll say things like, and your water will break. Well, then you read the stats. It's like, that happens in 25% of the cases.
Right.
That's not a norm at all.
And it
25%,
feels like you're
that's
peeing
not a
yourself.
norm,
Like
right?
it happens to me with my second, and I'm like, I don't know if I'm peeing myself. I don't know if the water broke. Something's happening there.
It's great to I think not overly educate because then you can be like, oh my goodness,
Yeah.
things can happen. But to also just really get to know your body and really like, I don't know if you have a midwife or a doctor or if you are like going to use a doula, but a doula is a great source of information that can tell you like, if that happens, that's very typical. If that doesn't happen, that's very typical. Like without increasing your stress, because I think you sometimes go into a medical field and they're like, your baby's heart rate's dropping. And you're like, okay. What does that mean? Well, I can explain it to you. Your body is squeezing your baby. You get a really big hug and see how your heart rate your heart rate might drop too.
I know, it doesn't act like it's so weird.
Right. It doesn't mean that it's super stressful, but you know, it's great to have that educational side where you're like, I understand what's happening. And I can see, you know, why in the first trimester are we so sick? It's because our placenta is not big enough to carry the hormonal load. So who's carrying it? You're carrying it. So that's why you're so sick. When your placenta is big enough, around 14 to 16 weeks, it usually takes over, which is why the second trimester is like the honeymoon period. You're like, I feel nothing. My body doesn't hurt. I have a cute little belly. Like it just looks like I overate some pasta. And this is amazing. And then you get to the third trimester and you've got the relaxin and your body's preparing for labor and everything's sort of shifting and opening and you're like, bladder pressure and like, you know, there's a lot lot of stuff and you're like, is all this normal? It totally is. And it's really, really good to have an advocate that's kind of going with you, that's like on your team that can answer your questions for everybody. So I won't be available. Wait, when is your due date?
January, I don't know.
Yeah, but I mean, I get to have this baby be like, see, I'm going to go sleep for 12 hours. I'm not going to be awake. So, but yeah, it's great to have.
That's a very good question.
Go for it.
So how do you incorporate nursing for newborn that's started?
So it really is up to the bio parents. I won't be nursing this baby. They would like me to pump for 4 weeks to give them the fresh milk. I haven't decided.
Is she going to try and bring on lactation?
No, they gave because she was in a coma after 2 days of delivery, so she never had the chance to nurse him. And she's like, he's fine. It's not something I miss. So I'm not going to stress about it. So yeah, but again, it's another month after a 9-month alien host that I will have been doing. So I'm not sure if I will. There's a drug now that I guess you can take that will immediately dry up your milk. So
Well, and you can use peppermint, right?
I can also I can rub peppermint all over your boobs, which will probably actually feel amazing. Very tender and sore. So, I'm not nursing. No big deal. Yeah.
You can experiment more.
I will, and I'm gonna report back next year on our
Can we talk breech, Amy?
Oh, yes.
Okay.
Oh, my goodness. Okay. So there's a really great website online. I think it's spinningbabies.com. But yes, I was breech. I wasn't breech. My baby was breech. And it was getting there to the end. A few things that helped me. One is I went to the chiropractor and I got an adjustment. So that was a really big deal. And then I did the cat cow, you know, and then I like elevated my pelvis, like literally like stacked like pillows underneath me. I mean, it was so big, it was really hard to do. It really was. I tried all of that and none of that really worked. But what really worked, different things work for different people, right? But for this little guy, I chased him with ice and peppermint, and he did not like that at all. So his head was up here, and I literally had this ice pack and peppermint, and then I was just like moving the ice and the peppermint I was just moving him, like chasing him.
Yeah.
So he was like, the baby doesn't like, his head's here, right?
No.
And so I'm like,
Has to be warm and cozy.
totally. Yeah, he's like, get away. yeah. So I literally chased him. I chased him down and I turned him with peppermint and ice.
Thank you.
That was good.
Nice.
Yeah.
I had a breech. Joel was breech too.
Was he?
And I had a midwife, and it was about 7 months, so there's still room to be moving around, right?
Oh, wow.
And she
yeah.
said, I'd like you to wash the floor 3 times a day.
Ugh.
So I got down on my hands and knees.
Oh,
and
like wash the floor, like Cinderella style.
Get down on your knees and wash the floor. And about 2 weeks later, I was just sitting there, and all of a sudden, this big alien move was going on. I'm like, whoa! And then there was no more room for him to do that again.
Yeah.
So that was the other thing midwives did, which was amazing.
Yeah.
Anytime. I had clean floors. This was before the nesting phase.
Yeah.
Too bad.
Didn't last after that.
This was like 2, maybe 3 weeks before I delivered.
That's
So
That's really tight.
It was really
And he was
tight.
big boy.
And he was a
Yeah.
big boy. He was over 9'6", I think.
Oh,
So
I
yeah,
know
that
how
was
much that
a big
changed.
move. It was a big move, but I did it. Yeah. Yeah, we did it. Yeah. So it is possible. It is possible to move the baby.
Does anybody have any other pressing questions or things they want to know? Or
I would. My baby was posterior.
Okay.
And she was born. Is there any oils that could help with that?
that's a tricky one because you don't actually know that that's happening until you're in labor. And did you have back labor?
I did. Yeah.
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 So
For several days.
that means they're not looking down; they're looking up at the ceiling.
Yeah.
So, and actually, they can't come out that way. So
Yeah.
the reason why labor is so painful is because their head is bashing up against your tailbone.
Yeah.
So, but then usually babes, as they come out, they will do like, they can't come out any other way, so they'll spin, or doctor or midwife will sort of twist them,
Manipulate it.
solid coming out. So
It's
it's a hard one to know until you're actually in labor, because they're like, oh, your head down, perfect.
yeah, sure.
Yeah, so I can talk to that one.
Yeah, please do.
All 4 were back labor or posterior, except, well, he wasn't posterior until mid-labor. So he was perfectly in his little
In a great
nook,
spot.
in a great spot, and he turned in labor and delivered face up.
Wow.
And the other
Wow.
3
That's
were
amazing.
all posterior back labor, hurt so much. But with him, I had no back labor. It was very bizarre, but he came up sunny side up.
Interesting. Wow. That's amazing.
Yeah.
But you didn't experience back labor.
No,
So he just turned kind of right at the end there.
yeah, right at the end, it was weird. And my midwife did help me because he was stuck.
Was his whole body up or just his head? Like, did he? Did the shoulders kind of twist
I
around?
don't know, but
Okay.
he came out.
You weren't watching?
I think my husband was like off the bottle, so he doesn't even know. But yeah, it was. She needed to help me because he got stuck.
Yeah.
Right at the end, and I was like, if we go any longer, I'm like, give me an epidural, give me some oxytocin, like, do it all.
Yeah.
She's like, no, I think
We're at
I
the
can
end.
help you.
Yeah.
Help me out. And then he was out the 3 questions because they made me wait. But yeah, the hands and knees things for posterior and chiro both worked really well to turn my other 2.
Okay.
But with my daughter, I had no idea.
Yeah. One thing I got some advice from my mom before I had my first baby that I thought was really good advice, and that was that if you're delivering in a hospital, they go for convenience. They really go for convenience. And she said, if you want to be on your hands and knees on that bed, then get on your hands and knees and deliver that way. Like, if that's what you feel better doing, then just do it.
Right.
They will follow you, but if they can have you with your feet up in the stirrups and the whole thing, then they'll do that, right? And so
If you're like, what should I do? They'll tell you.
right.
But if you go in there with a little bit more assertive, sort of, this is what I need, this is what I want.
Yeah. So I delivered Joel standing.
Nice.
Yeah, that was actually very cool. Very, very cool. But I had a midwife, so they were super accommodating, right?
They're like, what do you want to do? What do you feel?
Yeah. Well, I said I didn't want to do this.
Right. I'm pretty sure that's right at the end. Yeah. When you hear that, you're like, you're almost in. If you're like, I'm done, I'm actually leaving, I'm not doing it. Just
That's funny.
Well,
Baby? Yeah, do you want to talk about a little bit about baby? Or
you can go. I mean, I don't know these ones, so.
Okay, yeah, for
you can
sure.
chat about
So,
those.
well, first of all, yes, we have our new baby collection, and this sold out really fast, but it's coming back. It's coming back
Yay.
somewhere around, I think they said mid-June, maybe around the 18th, so just keep your eyes open. But what it is you have a baby wash, and this is hair and body, whatever. I would use it. I would use it for myself.
It smells great.
Like, especially post-delivery. Like, you think about, like, I actually bought, I remember one of my pregnancies, I bought a special, like, Perry wash just for down there. But this is great. I really, really like it. And then this is the lotion and the smell. How would you guys describe the smell? It smells
It's kind of flowery compared to babyish, but I like it when I use it.
Yeah, it's I can't describe. I don't know how to describe it. It's different than anything else I've ever smelled, but I really like it.
I think it smells like a cute big baby.
Yeah, but it doesn't smell like baby wash, like you'd expect a baby wash to smell. It's
very light.
It is very
Yeah,
light.
it's not. Did you say pass it around?
Yeah, do you guys want to pass it around? So anyway, I love it. My 2-year-old, I have to watch him in the bath because he'll just keep washing himself because he likes it so much.
But you can lock that.
Oh, you can.
You can lock it so baby doesn't do that.
Smart.
dōTERRA thinks of everything.
And then we have a diaper rash cream, a bump cream, and this is really good.
Slash sunscreen.
Yeah, that works
Icing.
really well.
Yes.
It does work really well.
Yes, has really, really good ingredients in it. It's not marketed, we're not supposed to market it as SPF because it doesn't say SPF on it. Just want to be really, really clear so we're compliant. But it does have a lot of zinc oxide in it. It's very good.
You put a little on your nose, your face.
You can use it for skin protection. Really official, yeah. So post baby, I mean, we did mention teething. I think that's something that I think is something that is an issue, right, for babies. I think a little bit later on. Love clove with a little bit of olive oil, and then put that on the gums. Copaiba is awesome. I also like lavender, and we now use Siberian fir instead of white fir, but lavender and Siberian fir along with jaw diluted is really great for just kind of soothing those.
Didn't you put frankincense on your baby's soft spot when he was born?
Yeah, and I did myrrh on his belly button. Yeah. What else?
Oh, I was gonna say, because with Bear, we had a foster baby for a little while that had some major digestive issues, and I did use diluted digestin on his belly, and he used to like projectile vomit every single feed. And within 3 days of using that, and I definitely used it heavily diluted because he was like a 5-pound baby.
So,
he was tiny.
What? How much did you dilute? Because I'm using that right now. But
Yeah.
I just did a drop within like a roller.
Yeah.
Well, could I go more than a drop?
Yes. Yeah. Absolutely.
It's not helping.
And I ended up putting diluted oil in his body. So he then got used to drinking digestive. But that, it honestly made a massive difference. Like
I feel like you got a sugar.
he was pooping like once every 5 days, and then projectile vomiting every time he met. So I started putting diluted digestin in his bottle, and then also on his belly 3 times a day.
Oh.
So I would say I would just do it in my hand. So probably doing it in a roll on is probably better.
Yeah.
But I probably did. Yeah,
They're already diluted.
They're already diluted. But at the time they didn't have them, so I was using like 1 drop of digestin to maybe 4 or 5 of coconut oil.
Oh,
So it wasn't crazy diluted, but it was like
Enough.
And
Yeah.
it was
Yeah.
1 to 5.
Yeah,
So
I just made up my own roller. But I was Googling like
how much can
how
I
much
use?
Yeah.
dilution charts at like 11 o'clock at
That's fun.
Yeah, no, I think the touch would be fine.
These are amazing.
Yeah, the touch would be
There
fine,
you go.
and like test it on you and see how tingly your skin gets. Like use it on a more sensitive spot, you know, that you could feel right away and be like, okay, if you can't feel it, then that's perfect. Yeah.
Would it be crazy to put it, if you're breastfeeding, would it be crazy to put it on the breast so that it's ingested that way?
Yeah, a lot of people do. So when people are putting fennel, I've heard of this for mommies who are trying to increase lactation for milk supply. They putting that on, and then they were colicky, but then they stopped because they
were getting the
were
fennel.
getting the
and
fennel
the fennel was
in the
helping
milk.
with the colic.
Yeah, because fennel's in the digestin, right? It's got the same.
Yeah.
So that's another way of doing it. But yeah, I've heard of, I have another friend, a really good friend who put just 1 drop in a bottle, and that helped from projectile vomiting to not.
Yeah.
Yeah, had major tummy upset issues, and it really helped a lot. So digestin is just brilliant for babies.
Another thing for like breast care, that was one of the post things I had, like a yeast infection or cracked nipples, stuff like that. Babes can ingest the oil, so I wouldn't like put it right on and then slap them on, but like at the end of the feed, that's when you would treat it, so that it has a couple hours to soak in before babe gets back on it, but then not feeling like you have to wash it off before you nurse again.
So would that help with the baby's thrush if they got thrush?
Totally.
Yeah, melaleuca and lavender.
And the problem with thrush and yeast is that you're just
Oh yeah, it just goes back and
Do
forth.
you dilute it?
no?
I would, now that they have the touch, I would use the touch. Before I probably would have, but it also depends on your sensitivity and the intensity of the yeast that you're fighting. Same with like mastitis, like because it can just be like a cyclical thing if you don't get it under
Your
control.
skin can use the moisture anyway, especially if you're already cracking or whatever.
Yeah.
So it's kind of nice to have the.
And then block dust is lavender, right?
What's that?
Block dust.
Oh yeah, you could use that. You could use melaleuca as another one that's really good. Both of those are really good. Yeah.
Trying to see if there's anything specific.
One thing that I did, I mean, if you guys haven't heard of this, is like putting water on a diaper and putting it in the microwave for like 10 seconds and then putting that on if you have
just a warm compress.
Yeah, warm compress. Yeah, you can do that. I mean, you could
Like
sit in the bath and do
whatever.
like but it's nice because those diapers that like the disposable ones, they like soak up the liquid, and then it can give you a lot of relief if you're struggling.
You could also spray some oils on it.
Yeah, totally.
Yeah.
Totally. Yeah.
I use lavender a lot when my milk came in because you know how it's just all lumps and bumps and milk.
Oh, yeah.
So I use that a lot. But last week I had a black duck and I was like, is this trash or is this black duck? What is this?
Yeah.
So
Well, and I think again, because oils, they seep into the need. Like it's not just like, well, lavender will only work for this. If you think it's a black duck, but you're not totally sure, and it might be thresh, do it all.
Yeah.
Like do all the things, because one of them will work.
Do
all the things.
It's gonna soothe and calm everything.
Yeah. So whatever the problem is, you'll be addressing it, even if you didn't know.
makes sense.
Yeah.
And then there's the whole cabbage leaf thing for
Right.
too.
Yeah, you can do that too. Absolutely. Yeah, there's so many really great things. Yeah, I'm trying to think of anything else. Any other baby things?
What baby age can you start using oils topically?
I used them on Wilson the day he was born.
Yeah, I was gonna say right from the batch,
Right.
fresh out of the oven.
Yeah, I used them from the beginning. I used all of the touch oils on him since he was born. I mean, not every day, but as needed, depending on what it was. So.
Yeah.
Thank you.
And again, be aware, like be watching your baby. If you notice that they turn red or whatever, maybe dye a little bit more and try in a less sensitive spot, like on the bottom of the foot. If you're using something on the tummy or.
What about, are there oils that will help with jaundice? That's a common problem
Oh,
with babies.
right.
All of mine
I
have
mean,
jaundice.
lemongrass is for
Right.
adults, for kidney.
Right.
So I wonder. I mean, I've never tried.
Jaundice. Yeah. Hold on a second. By the
Juniper's
way,
for kidneys too.
this is a really great book. This is Essential Oils for Pregnancy, Birth, and Babies. by Stephanie Britt.
I am.
This is a really great reference. Pregnancy, Birth, and Babies. Dr. Britt, not Dr. Britt. Sorry, she's not a doctor. Stephanie Britt.
She's a midwife.
She's a midwife. Yeah, sorry. But jaundice. Hang on. There's lots of references in here. Hold on.
I know the drinking sound.
Yes. Okay.
Yeah.
Wild orange is in there. Lemon is in there. Wild. Oh yeah, that one.
Because they're
Let me
cleansing.
just see if I can pull it up in the actual. I can't remember off the top of my head, but I know that mommies have used it.
Saying geranium in the
Yeah.
essentials.
Any other modern? Yeah.
Hold on a second.
On here it says geranium.
Geranium, topically. Okay. Oh, jaundice, here you go. 60% of babies get a mild form, usually peaks around day 3 as liver is trying to break up the bilirubin in the body. Use geranium and lemon on the baby's feet to help support the liver and breaking that up. So I would just,
in a patch of sunshine.
yeah, exactly. Yeah, give them,
And
yeah,
vitamin D.
yeah, exactly. Put
Even
them-
though they already look tan.
Yeah.
They're not.
I know, yeah. So just as apply 1 drop to the baby's feet at every diaper change, and undress baby and expose as much skin as possible to direct sunlight. So, yeah.
Unless it's mulch.
Well, I've got all the lamps in the house and stuck them in one spot in front of the window and would undress the baby and stick them there with like all the lamps on and focus right on them because I really didn't want to do the incubator thing.
Oh, yeah.
Right?
Yeah.
And so that's what I did with mine when it was cold and,
And the more
couldn't
you-
do it out.
The more they nurse the.
Oh yeah, and I fed them
It comes out of their
relentlessly,
system.
but I did that anyway because I wanted fat babies.
Fat babies are awesome. Okay, well, let's, I think we'll go ahead and wrap it up, but let me just double check and see if anybody else has any questions. Okay, cool. Yeah, we'll post the references, the sheets. We'll scan them and then post them to the event page. Okay? Awesome. So thanks for joining us, you guys, and have a good night.